Philippines, and Dr. Sport Thailand, Professor Atori Singapore, and Professor Liao Chinese Taipei. So today, yes, I say to introduce Professor Iwasaki, and she will introduce all of the speakers today as the second day. And this is the really important APEC meeting with the International Academy of CIO, and we make the publications about the all talk up, everything talking, and also we put it the YouTube and APEC website. So I'm very happy to introduce first the Professor Iwasaki, who is the director of the Smart Silver Innovations. Also, she has some other functions like Policy Council of the Japanese government as a member, and of course the deputy director of the Waseda Institute of Data Government. So I hope she will manage to have the excellent session with the remarkable expert today. So Professor Iwasaki, please.
Good evening, good afternoon, and good morning, everybody. Thank you very much for your very kind introduction, Dr. Obi. My name is Naoko Iwasaki, moderator of today's forum, as well as director of APEC Smart Silver Innovations. At first, this session will discuss on innovation for aging society by utilizing the emerging technologies and applications under the era of smart silver innovations. So our major topics are what is the most important activities and for digital transformation in the post-COVID-19 pandemic, and what is the most challenging function of smart silver innovation for SDGs, and how to reduce digital divide among the old persons and promote digital social inclusion. And why will smart silver innovation be one of top priorities among global issues, and how digital government and smart city can solve the aging issues. So this forum is to find appropriate and digital solutions to solve the issues on aging society and by ICT. So especially this forum will focus on the smart silver innovation and including the ICT applications, so emerging technologies, healthcare, and the capacity building sectors. The forum is also to examine and improve the level of awareness on aging society for all generations. So through an APEC project on ICT applications and for people with special needs from 2012 to 2019, we have already obtained the very fruitful results and knowledge and several recommendations. So therefore, by utilizing as a result, and we would like to continue to implement this scheme from theory to practice with open innovation. So the goal is to establish a society which implements and with a smart silver innovation, and we will work together among APEC economies on implementation and the relevant and fields and transfer of solutions models to other economies, which will be suffered and from the aging issues in near future. So moreover, the most important thing is that we share knowledge and experience on emerging technologies and which can be utilized to the aging issues among APEC economies. So I'd like to introduce all great speakers today, and Professor Dr. Chen Yin Liang, Nanyang Technological University, Singapore, and Professor Dr. Yang Fen Chen, Dean, Institute of E-Government and Peking University, China, and Professor Dr. Suhono Spankat, Bandung Institute of Technology, Director, Smart City and Community Innovation Center, President, Smart Indonesia Initiatives, and Professor Dr. Jirapong Sungho, Vice Rector and CIO at Thammasat University, Thailand. And finally, Professor Dr. Alexander Lajov, Laneba University, and from Russia. But unfortunately, as for the Professor Dr. Alexander, due to a heavy illness in bed today, so he cannot make his speech. So, but he kindly sent us his presentation PowerPoint. So later, I'd like to show you his presentation after all presentation. So we hope and he will recover from his illness soon. Okay, let's start today's sessions. The first speaker is Professor Dr. Chen Yen Lian, so Nanyang Technological University.
Can you see the slide? Okay, great. Yeah. Okay. So, a big thank you, for the invitation to present at this forum. I am from, Nanyang Technological University. Currently, I'm the Associate Provost for Faculty Affairs. But I also run, two centers. One, at the, at the university level, research institute, and one at the school level. But the focus is very much on, older adults and technology. So, in the presentation, what I would like to talk about is to look at, COVID challenge and the technology-enabled solutioning, for older adults. And in this case, to look at one of the projects that we have focused on, which is actually health coaching and contactless health coaching. So, I think we are all aware of, the aging issues, globally, and in Singapore, we are aging rapidly. And if we actually look at the age pyramid, from 2005 right up to, 2060, you see that, we will become top heavy with more people, in the older age groups. And, and this is actually, seeing, also changes in terms of living arrangements of elderly in the Singapore resident households. We have more of the elderly, living alone. And, and if we actually look at, elderly and social isolation and risk, for seniors who live alone, risk experiencing social isolation, depression, and sleep, poor sleep quality. And, I think we all know that health is not just a personal issue. It is really a public health concern. And, one of the challenges is really to identify and target interventions for the elderly. And, and in many cases, lonely elderly, if we can actually address some of these issues, we may be able to significantly decrease, visits to the hospital and to bring down the healthcare cost. Right. So when I started the project, I think about 5 years ago, and this was actually a project funded by the Ministry of Health. We were looking at health and caregiving systems, and we look at several of these pointers. So basically, in these few areas of productivity, challenges, and pain points, one of the things that we actually have, looked into is actually to say that, yes, we have health data, but are they optimized enough for us to be able to use that, professionally and individually? Do we have a good management information system? And what are some of the challenges? We actually see, more and more technology is also devices being introduced. But are these solutions just technological, or are they actually meeting the needs of the elderly and their lifestyles? So, another thing that we also come across is that, although we have health records, are these health records complete? Are they shared? And what then are the pain points? Are there powerful, software, can key performance indicators be measured? and are there good, robust user studies to actually get feedback to the design of elderly-friendly apps, products, and services. So these are some of the things that, we looked into, and then, in one of the, in the project itself, we wanted to actually see how we can address health and the caregiving, ecosystem. So, and then we went on to do several of the projects, and this is actually the latest that we have evolved from this big project into a project that was actually, tested during, the COVID situation last year. Because we were actually looking at face-to-face, interaction with the seniors, and the health coaches. But last year we couldn't do the face-to-face interaction. So faced with the COVID restrictions and social distancing, we had to come up with, innovative ideas. How is it that we can actually, connect health coaches or volunteers, to older adults and still be able to, have this, the conduct of, health coaching sessions. And this is what we have done. We, of course, introduce, technology to help to engage, and we taught the elderly how to use Zoom, and we also taught them on fundamentals in terms of, foundation in gerontology, health coaching basics, nutrition for older adults, and exercise, and fitness, and so on. Now, this is really to train the volunteers to be, empowered to help the older adults in the community. So the whole idea is actually to reach out to the community and empower the community to help the community, right? Yeah. And what is the methodology? We brought in volunteers, 20 of them, trained them in Zoom, meetings, and then we have them selected, through a process that they are, good enough to be health coaches. We did a pre-survey of 24, older adults, and then we also measure, using established skills to look at anxiety, sociability, loneliness, and support, and so on. And in the study itself, we conducted 4 sessions with the older adults, each health coach, 2 sessions per week. And we also asked the elderly to take, pictures of the food that they take. And then after, the study, we actually also administer the, post-survey, right? And this is what we have found out. Remembering that we were not able to get in touch with the elderly, which means that everything is actually online, and with a health coach. And we also see that, the older adults do regular exercise in their own, before the health coaching. But after the health coaching, we see more of them actually engaging in exercise in increased frequency. What are some of the challenges as we actually look into technology-based solution without the face-to-face interaction? One of the challenges that we face is that we were afraid that they might, incur physical injuries, and because of the lack of motivation of doing things alone, emotionally, they may not be able to actually cope with it. Of course, the impact of COVID is that, they couldn't go out of, the home, and, not wanting to do things, exercising on their own. But we still see some improvements in terms of exercise. That means through coaching, on virtually, we might be able to even change the behaviors of the older adults. Then we also looked into the, whether improvements in diet, and we taught them, it's like the healthy plate, and this is actually, it's like promoted by the Singapore Health Promotion Board in terms of a healthy plate. We introduced the healthy plate, it's like, and we could also see the improvement in terms of diet, the way that they eat in variety and moderation, reducing the frequency of eating outside. Like, I think Singapore is actually very well known for eating outside, like in hawker centers, and they take less sugar, less salt, more positive influence on the, like family members in terms of eating healthily. Now, when we actually look at the results, like before and after, we actually see them, like exercising more and eating better. And that is actually, like very promising results when we, like in a total, like circuit breaker lockdown, like we were not able to get out of the homes, right? So what are some of the problems faced by the health coaching project? It's like in looking at the older adult participants, these are some of the challenges we face, right? Online privacy concerns, it's like they're afraid, it's like to share, it's like more about themselves. The other thing is about unfamiliarity with technology and also the lack of access to smart devices. So how did we overcome, it's like these challenges? These challenges, it's like, it's like teaching them how to use Zoom and delivering of the tablets to the individuals who need them. The other problem is really about the it's like privacy issues, which we are working with, it's like our IT colleagues. For the health coaches, as we mentioned, that the health coaches are older adults in the community that we have and recruited them to provide health coaching, it's like the neighbors, and they went through, it's like the training, as I mentioned earlier. But even for the health coaches, it's like they are also unfamiliar with technology, and when we actually talk about the technical issues, there was a lot of distraction from coaching itself. And again, it's also about training them and assigning someone, it's like to actually work alongside with the health coaches in addressing some of the issues introduced by technology, right? So I'm going to actually, it's like show, it's like a very short video clip of a system that we are trying to develop. And the whole idea is actually Uberizing health coaching, it's like for older adults. The whole idea is actually to, it's like provide a technological solution to assign health coaches to older adults in home-based care.
The Hokomo system is a one-stop integrated optimization solution for home care service providers in Singapore. To improve the productivity of home care operations, 5 key services were targeted for optimization. For the General Health Check service, the CareHi app facilitates caregivers in conducting efficient health checkup and health data collection. General health data such as weight, blood pressure, and glucose levels are recorded using CareHi. The accumulated data is then transferred to a centralized database, where it is safely stored. The meal planning and delivery component is realized by the Planis app. Staff and volunteers assigned to elderly clients are able to check their client's profile, with the app generating meal schedules and informing caregivers of any special dietary needs clients might have. When it is time for delivery, volunteers and caregivers are provided with the most optimized delivery route based on client proximity. The medication delivery and adherence component ensures optimal routing for medication delivery, computing the best possible routes and schedules, and allowing caregivers easy access to client data. Moreover, integration of the QP Box medication reminder system facilitates the planning, arrangement, and bookkeeping of client data. The rehab therapy component introduces exergames and exercise regimes for clients. Through the virtual exercise therapist system employing Microsoft Kinect sensor, home care staff and volunteers are able to support elderly clients in starting and maintaining an exercise regime. The onboard fitness analytics module allows for the physical performance and health conditions of clients to be tracked. The system boasts a myriad of motion-based gameplay to keep elderly clients healthy, happy, and motivated. The emergency response component utilizes smart home monitoring technologies to set up an intelligent assisted living ecosystem. Through the use of passive and unobtrusive sensor-based technologies, clients' daily living habits such as movement, light, temperature, and home power consumption can be observed. In the case of unusual occurrences, alerts can be sent to clients' family members, caregivers, or home care centers. The Assessment and Report module integrates the information accrued from all standing technologies to generate up-to-date reports, facilitating the evolving commentary aimed to increase the productivity, quality, and capacity of home care service providers.
So maybe to continue, what are some of the lessons that we learned as we actually build technological solutions? We design for health, we design for humanity, we design for impact. I think one of the key lessons that we learned is really to know the users. Who are we designing for? Designing for the elderly, for the caregivers, for the healthcare professionals, to really understand the requirements and the needs. The other thing is actually to take a purpose intentional, user-centered usability engineering approach to design, develop, and implement technology-enabled healthcare systems. And the whole idea is not only just, looking at as I like it, but looking into acceptance and adoption, right? Last year, one of our, advisory board members, from Milken Institute and myself, we look into COVID and acceleration of technologies. And it is actually, basically, saying that in the pandemic has actually driven the adoption of health tech for the, for the elderly. And it has actually changed, in terms of mindset, in terms of acceptance, in terms of adoption. And one of the things that, we are very, I'm very keen to do is to really look at a global network of older adults' voices, because we design systems, we design devices, but if we are able to actually, connect and begin to actually hear, older adults giving us, their thoughts, their inputs, their feedback on the systems and the, technologies that we build, then that will be so much, more efficient and effective. And we can actually bring down costs, we can share with one another, right? So the lesson that I learned, because my background is in human-computer interaction, is really to design with the heart and the mind. A lot of times, we look at systematic approach and so on, but at the end of the day, the technology is for people, and understanding that we are designing for, for the humans, for humanity, and also impact is important, in terms of, putting our heart into the design. I just want to have, for the next couple of minutes, just to talk about NTU Aging Research Institute for Society and Education, in which Prof. Nayuko is one of the advisory board members. So basically, in NTU, we are trying to consolidate, colleagues who are actually working on aging-related research. And we, when we actually look at NTU, there are about 200 over people who are actually working on aging-related research. And we can actually divide them into 4 different trusts: aging medicine, social integration, education, aging in place, and lifestyle enhancement. And the whole idea is, the vision is to empower the aging community and improve quality of life. NTU being a technological university, we will be focusing on technologies, but on the other hand, it is not only just about technologies, but really understanding people, so understanding aging related and psychosocial issues, and how do we empower or enable healthy, active, independent individuals with meaningful social integration and productivity. You know, it's like more and more of the older adults, you know, it's like they, you know, it's like they can still be very active and productive even in their older age. So this is actually what, you know, it's like the ARISE, you know, it's like tries to do, you know, it's like in terms of looking at funding, collaborations, and also impact in research, you know, it's like projects, as well as, you know, it's like scholarly publications. Right. One of the things that we look into in terms of health focus, when we look at the, you know, it's like the health focus, you know, it's like stages, there are, you know, it's like promotive, preventive, curative, rehabilitative, and palliative. And, you know, it's like we have colleagues who are working in all these different stages, but in terms of, you know, it's like looking at promoting and preventative, you know, like measures, we think this is very important because, you know, it's like we can actually be targeting the individual, but as I mentioned, you know, it's like health is not only an individual concern, it is also the community, and we also spend a lot of time in the workplaces too. So, you know, it's like when we actually look at the different disciplinary, you know, it's like approaches, we can actually be combining them. You know, it's like, and do cross-cutting, inter-trust, multidisciplinary strategies. And the outcomes, it really depends. It can be mindset change, behavioral change, you know, it's like sociability, lifestyle, and policy, right? And the outcomes is really to, you know, it's like empower the older adults to live well, age well, and age smart. Right, I'm going to stop here, you know, like, and, you know, so the project has been funded by the National Research Foundation, and also the Ministry of Health.
Thank you very much for your great presentation. So later, I'd like to ask you to some questions. Thank you. Okay, our next speaker is Professor Dr. Yang Fenchen, Dean Institute of E-Government, Peking University, and his topic is the contactless economy and its potential role in solving the aging society problems. Dr. Yang, can you hear me?
Hello.
Hello.
Yeah.
I'm
very glad to have. I can see you. I want to share my PPT and.
Can you control your slides by yourself or from our side? Which is better for you? Oh.
Okay, can you give me, I need your help to put my slides on the, yeah.
Okay.
Hi everybody, I'm okay, thank you. I'm very happy, very glad to have the opportunity to have to share some ideas about the contactless service. Today, my topic is contactless service, helping solving the labor shortage in elderly care service. At first, I want to talk about the concept of contactless service. The meaning of contactless service is next slide, please. Contact service is an intelligent social and market service form, which takes human object human as the basic ways and relatively realize the physical and the spatial isolation of people in social communications. This concept includes the following key points. The first one is the contactless service. I think is an intelligent economic form. The second is the contactless service turns the contact service of people to people into the non-contact service of people through the network or POS. The third one is the core is the interpersonal, physical, and spatial isolation in social communication. Next slides, please. Next, I want to introduce the practice of contactless service during epidemic prevention and control period in China. I think as my observer, I think the main scenarios in contactless service is telecommuting. The second is online conference, and the third is logistics, including food, living materials, medical supplies, distribution, and takeout. The fourth is non-contact and remote inspection, non-contact diagnosis and health service, and the last one is online education. Next slide, please. Next, I want to talk about what circumstance must contactless service be adopted. I think there is some enlightenment can be obtained from the above scenarios. I think the contactless service is suitable for the first is epidemic, and then the second is labor shortage situation. The third is insufficient service supply for elderly. The next slide, please. Next, I want to talk about, based on the above discussion, I propose the following points and point out several applications that can be expected in the field of elderly care. The first one is health and living conditions monitoring of the elderly care. The second is family and communicating remote exploration. The third is home remote online party. The fourth is non-contact health consultation and medical diagnosis. The last one is remote purchase and the distribution of food and drink. Next slide, please. I think there is some core elements of contactless service in elderly care service. The data and the abilities is very important. The data is the most important basic resource to realize the contactless service. The second is getting information from the data. I think it's the basis of contactless service to obtain and analyze the data concerning the elderly living conditions and the demand of them. The third is the data acquisition method. The data acquisition method is very important and very complex. So I think some experience of contactless service for the purpose of prevention and control in during the epidemic period can provide reference for obtaining the data of contactless service for the elderly. In terms of, for example, in terms of epidemic prevention and control, the data to be collected are as follows. For example, health code, action track, temperature measurement record, medical record, and shopping bill, etc. The methods for data collection are as follows. Using mobile devices to record people's action status. Using temperature measurement equipment to measure people's health status. And using medical records to analyze care groups. And then providing service for users through shopping platform. And taking service for users through shopping and taking out the platform to provide the shopping and the logistic service for users. And the third point is the environment and ability of the elderly to use digital devices for interpersonal interaction. I think it is indispensable for the elderly to interact with service providers online. It's very important. The next slide, please. Another factors of the core elements of contactless service for in elderly care service is technology and tools. The technology, equipment, and the tools are the foundation of the contactless service. At first, the technology, especially is IoT and other technologies. For example, include IPv6, 5G, big data, cloud, big data, cloud service, AR, etc. Equipment and the tools, I think they are. It includes robots, UAVs, unmanned vehicles, and wearable devices. This equipment and the tools can be used in logistics, hospitals, communities, supermarkets, and health, medical, and community services. This is my presentation. Thank you very much for your listening.
Thank you very much for your great presentations and the contactless and economy and will be very huge and market also as a very important topic. Thank you very much. Okay, next speaker will be the Dr. Professor Suhono Hasso, and from Director of Smart Cities and Community Innovation Center, Chairman of Indonesian Smart City Associations. Professors, and the topic is smart cities and cities resilience and related with silver societies.
Thank you, Professor Iwasaki, and also good night, good morning from United States, and good night, I think, in Japan. I hope all are very good in this COVID condition. And I try to present with my presentation regarding, yes, yes. First, I will submit the title with the digital twin for smart city, but emphasize in cities resilience related with silver society, because in this session we talk about smart silver innovation. So we must talk about what is the challenge in the silver society. But of course, this is one of our journey to search, to study on how to contribute in our society. Well, yes, this is our previous discussion in regarding problem society, especially in Indonesian cities. Indonesia have more than 500 cities and municipalities, and every cities, especially in the capital of province, there are a lot of problems with the urbanization before COVID. There are about the congestion, about the traffic, about the waste management, with energy, and so on and so on. But after COVID or during COVID, there are difference. The big city now is empty. The hotel, big building is yes. We call this our cities finished because of COVID, because the health protocol and must redistribute our communication, physical communication, and then we can work in our rural, in our, yes, not in the central of city. Some cities in the United States also, yes, I think very only 10% or 20% for the citizen after COVID. So this is our consideration. Also in campus, in my university, also lockdown now. Studying in studying from home, not in studying in university physically. So we must try to change our mindset from the physical study, physical campus, to work from anywhere, work from home, and so on and so on. Also in work. So I think this is a challenge for the future of city. How to design of the future city with the condition, with the constraint, with the, yes, like in health and so on and so on. Yes, as I also presented many times in AIC forum, we try to find what is a smart city. Smart city is a city that can utilize its resource effectively and efficiently to solve any city challenges using smart solution by providing infrastructure and deliver city service to improve the quality of life. So for young people, for yes, child, young people, old people, also for the silver citizen must be enjoy, stay in the city. So how to manage, how to prepare for all the situation from the child, young, old, and aging people. This is our model for the smart city development. How to understand what is our life. Before COVID, we talk about the urbanization, and then how to improve the quality of life in our city. Now we change. The city is not the central, but how to redistribution for the people stay not only in the city center. I don't know Japan, in maybe more than 60% stay in the capital city. And Indonesia is more than 50% or nearly 60%. People stay in the city before COVID, but now it's redistributed again. Maybe only decrease. I don't know how many percent. So we try in principle what in every situation we try to understand what the situation in our life before COVID, of course, in COVID sensing with the health protocol, and we understand the situation in our area. This is red zone, green zone, and so on and so on, that we can understand and then act and follow with the service in our city. This is our basic concept for all situations, for all old, for silver, for younger, and so on, with the integrated, secure, sustained, very efficient, using the enabler to so that we can improve the quality of our life. And our concept with the digital twin, we try to understand what the real work in our city, in our village, in our farming, in our hospital, and so on. And then how to get the data collection, then transmit to the digital twin virtual replica. And then we understand what the real going on, and then we can simulate, we can the model, so that we can act with the speed, with the response enough, so that the situation for the transportation, for the health situation, and so on, we can manage well with the connectivity, cloud computing, security, with the scheduling, and so on and so on. So between the smart system and digital twin is our journey for the next 5 years. And this year we, in August, we organized the international conference of the digital twin for the smart society. That principally how to get the real words, cyber to physical system, IoT, sensor, and then how to integrate, how to clean the data, how to process the data, and how to analyze using AI, statistical technique, and how to simulate modeling, software, and so on, so that we can respond the real situation becoming better as our improve the quality of life objective. And then how to the resilient city? How about the city in Jakarta, city in Singapore, city in Tokyo, city in Kobe, city in New York, to facing with the COVID, to facing with the transportation, to facing with the disaster. So the resilient city is prepared to absorb and recover from any shock or stress while maintaining its essential function, structural, and identity, as well as adapting and thriving in the face of continual changes. So this is one of the important when we face with the COVID or with the disaster, transportation, and so on. Resilient city goal is a diverse livelihood and employment, social security, finance and contingency fund, reduce physical exposure, continue our critical service, reliable communication and mobility, effective and leadership management, empower stakeholder, integrated development planning, of course, for the silver people, so that we can improve the quality of the silver age. And then smart city is a public and private collaboration. Integrating smart building, smart city technology is the next frontier for building with required cooperation by public-private sector, include for the silver society. This only possible by sharing the benefit so that all may work together on a coherent strategy that will meet each one's goal. In the end, building a smart city can provide a modern, functional, and highly productive life for citizens and employees. Having a municipal plan that can be resilient and flexible in response to future challenges such as climate change and potential public health concerns is essential. This is a smart city building time, the data control spread of infection disease, like for the pandemic. If they will go to the building, use the temperature measurement equipment that integrate intelligent video, AI, and thermal imaging. Intelligent sensing equipment for epidemic prevention, inspection at key location, reduce manual investment, infection risk, and related costs. Facilitate that the remote operation of the building in a lockdown and interact with the grid. Connectivity for communication and entertainment is paramount. This is one of the smart city and restoration. This citizen includes aging people and business expect municipality to offer not only mean to survive, but to support continued thriving economically and in wellness. Using the smart city model would allow city government to act fast and use their resources effectively and efficiently to provide city service and needed infrastructure even in time of crisis. There are some our innovation development, like the video analytic using AI as a technology that process a digital video using signal, using a special algorithm to perform a security-related function. There are three common types of video analytic: fixed algorithm analytic, artificial intelligent learning algorithm, facial recognition system. This is our, we call it VIANA, video analytic with AI, smart CCTV with artificial intelligence. CCTV can provide real-time analysis. So improve for the digital twin, we can get the real data, and then we can simulate, and then we can ask for the real situation, proper action. The CCTV smart features such as face recognition, detection of number of visitors, viewing emotion, and estimation, detection of suspicious object, detection of suspicious action, and passing through restricted area. This is our some application: vehicle counting, social distancing detection, thermal detection, face recognition. This is for social distance analyzer, like COVID-19 for the masker detection and head temperature and the counting. Counting and the distance between people. And then the thermal detection working principle, we observe the temperature people that pass for the an area. Yes, this is our presentation from Indonesian side, especially from my university. Thank you very much.
Thank you very much, Dr. Suhono. Very interesting topic, and also we can understand the very important the emerging technologies. Also, especially the digital twins will be the key for the success of the smart cities. Thank you. Okay, next speaker is Professor Dr. Jirapong Sungkho, Vice Rector and CIO of Thammasat University, Thailand. And his topic is Bridging a Digital Divide for Senior Citizens in Thailand.
Okay, thank you, Professor Iwasaki, and good morning, JP, and for the remaining good afternoon and good evening, I guess. So today, first I'm going to share my screen. So you see my slide, right? Okay. So what I'm going to talk about is to talk about the digital divide for older adults in Thailand by giving you the case of one of the case that the Thai government trying to deliver the digital service to older adults. In this case, is to is the app for registering or booking the vaccine for older adults, and how the Thai government learn from that lesson, and how we can improve the digital service to the older adults. So let me first talk about the digital and older adults. I think like the first speaker, Professor Tang, talked about that even though we might see that most of senior citizen or adults using a lot of digital service, but the number is not really really impressive, because in Europe, in EU, there's study by Fundamental Rights Agency say that only 20% of people aged 75 years and older using internet at least occasionally. So only 20%, in compare with the about 98% of people who are 16 to 29 years old. So even though we see a lot of senior citizen or older people using internet, but in fact only 20% that really using it occasionally. And with COVID-19, this really have an effect on older people, because first they have to stay at home, and that caused them to have a high level of loneliness, because older people tend to already suffer from the loneliness already. And when COVID hits and they have to stay at home, that double the risk of people, older people, to suffer from loneliness even further because of the social distance measure. Another thing is, because of social distancing, they have to rely more on online service like telehealth, grocery delivery, and online engagement. But as I mentioned earlier, that only 20% that use internet occasionally. And another study by AGE saying that only 8% of person between 65 and to 24 have enough digital skill to do this kind of thing, like order grocery online or doing online engagement. So this is not a very good number. So this is quite evidence that digital divide really exists among older adults. Let's look at the number in Thailand. We at the National Statistics Office, they collect the data, I think, every year, and they collect how people using a computer and internet. And they found that only 25% of Thai's household have a computer, which is lower than global average at 49%, and again lower than among developing countries at 38%. And but this number is even lower than the number of internet penetration. The internet penetration in Thailand is quite high, but the person who able to use computer is very low. That one thing is because the ability to afford a computer for the household, like at our university at Thammasat, when we do online learning, quite a number of students don't have the PC or the tablet. Some they have to only rely on online class to their mobile phone. So we have to loan them the tablet PC, and that I'm surprised to that not all students have computers here at Thammasat. And in Thailand, only 6% of people who are more than 50 years old use computer, and that's only 6%, and only 33% use the internet. So again, the digital divide in Thailand is also really evidence. So, and as I mentioned, I'm going to talk about the case that really highlight how digital divide and how we fix it when come to the delivering digital service to older adults. So the Thai government, in order to promote the COVID-19 vaccination, they introduced the application called More Prom, which is in translation is called Dr. Ready, for citizens to book the vaccine. And the first group of people who is allowed to book the vaccine is people who are 60 years old, which account for about 11.7 million people, and people with chronic disease, which is about 4.3 million people. And in total, it's about 16 million. They call it the project 16 dose for 16 million people. And as you can see that, in Thailand, the number of people who infect COVID, we just have the third wave, and today we just have about 4,000 cases, 4,000 new cases today. So they introduced the service, and the channel to introduce service is through channel from the mobile app called More Prom app, and also from the Line OA or Line official account, because most people, even and especially older people, they already use Line in Thailand, which is equivalent to WhatsApp in the US or Facebook Messenger in other countries. And the app is actually really intuitive for me, and for most people, really intuitive. It's really simple. When you want to use the app, you just go to Line and add More Prom as a friend, and then you just enter your citizen ID and typing some number at the back of your ID card, and then you just click book, and then that's it. So for most people, it's pretty straightforward, and it's really well-designed app, and the government think, it should be good for people, and shouldn't be a problem for most people to register or booking the vaccine. So they start asking people to book from May 1st, okay, until May 30. And this is how many people who book the vaccine. As you can see, the first day we get about 400,000 people out of 16 million. Second day is like 600 million, and people starting complain about the apps, like, it's not very stable, and they can't book it, and some people don't have the they have to put the number, especially when they use the app. They have to put the password, which is the number in the back of their citizen ID. And some of them, some of the IDs already got, that number is already blurred. Also, they don't have the number. So that caused a lot of trouble for many people. So they have the government have to, improve the apps. So they have to introduce the second version of the apps, but the number isn't getting any better until almost mid-month. The number only reached like 2 million. Okay, so what they did is they promote the offline booking, as another channel. So they announced that, okay, now we have provide offline booking at the about 100 or 126 hospital. Sorry, the slide in Thai, but that's how they promote it to the app and to the social media and to the news. That okay, you can also not only with the app, you can go to the hospital to book the number, so that the number just improve a little bit, and then until they introduce a call center where you don't have to book through the apps or to offline channel, but you can call. At first, they don't have the call center, so they can call to do the booking. And the first place that allow people to book to call center is at our university, Thammasat University, we set up a call center, especially for this task to help the government to help people to book the vaccine. So the number climb up to about, get like almost 1 million a day. And then the number climb up to like 7 million and 8 million. So that's how, the number get better, because we introduced offline channel for booking. And another interesting fact is that the line account for about 80% of booking. I mean, at the first 2 weeks of booking period. Okay. And this is from my own analysis and from the news that why lower number of people are booking the vaccine. And one obvious thing is the digital divide problem, because most older adults do not own smartphone. And even some of them have smartphone, they don't have skill. They're not good enough to, they don't have enough skill to book the vaccine. Even though we think it's easy, but to them it's complicated. You have to type in the ID, they have to type in the password. Why not just click, just one click and that's it, right? So I think digital divide doesn't mean lack of device, but also lack of skills as well. Another issue is about the apps, because the booking process is quite, like I said, right? You have to download the app or add a friend in line, which is quite troublesome for some people. And also it costs from the stability of the app, because even they get through to the app, but when they book it, the app doesn't respond properly. And finally, it's about the user. They're confused because, there are two, like before the COVID or during the COVID, the government introduced a lot of apps. So people got confused which app should they use. And they're not like single source of information for booking service. When they have problem, they don't know what to look at, where the information or how the information that can fix that problem. And obviously there's some vaccine fear for some seniors or some older adults as well, because I think that they stay home, they're not at risk, so why they take the vaccine. So that might be the cause of the lower number of booking. So from what we learned and what we tried, what we did is it quite so we're gonna give the recommendation to the how when we trying to deliver digital service to older adults. So what we have to keep in mind, that the first thing is digital device still exists, right? Not only the lack of device, but also lack of skills. So and the recommendation is, first, try to keep it very simple with especially the apps and the process, not only and focus on the familiar channel usage. Like in Thailand case, online account for 80%. So you have to focus on that and prepare for other options. Like when we have lower number, we introduce offline channel, we introduce call center, and a lot of people only have features phone, especially older adults. So we don't forget on that too. I think one case in Taiwan, they did a good job when they introduced digital service. They think they account for all channels that older adults might have, from smartphone, feature phones, or they make it very simple. Whatever device you have, you can access to the service. And finally, is if you have a very good IT team, then you can adapt to the needs to fix the problem. So that's pretty much my lesson learned in Thailand and the recommendations. So thank you very much.
Thank you very much, and great presentations. And we are very interested in the digital divide and for the aging peoples. Thank you very much. And so, as the last the speaker is the Professor Dr. Alexander Lajov, Lanehua University, Russia. But today, and he cannot attend our forum today. So his topic is how to post COVID-19 data and knowledge can affect smart silver innovation. So I have already received his presentation paper. So I'd like to show you the first page of his presentation. So next time I will share his knowledge and research the next time. Okay. Next, we would like to ask some questions to all speakers, but today we don't have enough time to discuss a lot of my questions. So, please answer my questions within a few minutes, just 3 minutes. And if possible, could you include your recommendations for APEC as well as our project on smart silver innovations. Okay, at first, the Dr. Professor Chen, thank you very much for your great activities on contactless and health and coaching. So now in Japan, we are suffering from the social isolation. So what is the best solution to include the aging people to join these activities?
Yeah, thanks. I think one of the things that we learned, to engage the elderly is also to reach out, via the community network. So in Singapore, we have what we call the, the senior activity centers, where they look after, a few hundred elderly in the community. And that is really our touch point in the community. When we want to actually reach out to the households, we will actually reach out to the senior activity centers or the community centers. So, in one of the projects, I think I've shared that before, is on exercise. We can actually be encouraging the elderly individually to exercise, but if we get the, the community, the neighbors, the friends, to encourage them to exercise, then we actually get a lot more people at exercise. So, starting from one person to one community center to one senior activity center, you can actually get more people, from the different community centers to be exercising together. And one of the things that we have actually done is actually to do some kind of, nudging of, programs, initiatives to change mindset and to change behaviors. So if someone is actually not exercising, you get groups of individuals to encourage them to exercise, give them, goals and motivation, then they'll exercise. So coming back to the question about loneliness, social isolation, there is, also that, that the importance of reaching out to them. I realized that, when I was actually, looking at reaching out the elderly through homes, to activity centers, I could only reach out to, the already quite socially active elderly. But those who are actually really staying at home, we have no means to actually reach out to them unless we reach out to the community, the elderly, so that we empower them to reach out to the, to their neighbors and their friends whom they know where they are. So that's the reason why we actually started looking at health coaching as one of the initiatives. It's really, empowering the community, to reach out to, older adults in the neighborhood. Yeah. Yes. can hear you. Naoko?
Thank you very much for your recommendation. Okay, the second is Professor Dr. Yang. You mentioned the contactless economy. The contactless economic market in the Asia is expected to at least more than double by 2025. So my question is, what is the most important technologies, or what is the most important role of new technologies for the contactless economies?
I think the most important technology is IoT. Yeah. Thank you. Yeah. Okay.
So we can utilize an IoT for this in a new market.
Yeah.
You think? Okay.
Yeah. In fact, there are a lot of new market innovations and technology innovations in the prevention and control epidemic period. But so these innovations can be used in the countless service in elderly care service, but countless service in the elderly care service also have some problems because the elderly. The elderly need to contact with others more closely. So I think it's a difficult situation. It's a dilemma. But in labor shortage situation, I can't find alternatives to resolve this situation. That's my idea. Yeah.
Thank you very much for your comment. Okay. The next, the Professor Dr. Suhono. Today, thank you very much for very fruitful presentations, such as new technologies, digital twin. So how digital government and smart city can solve the aging issues by utilizing digital twin? Professor Suhono.
Sorry, yeah.
Okay.
One of the mute and unmute. Yeah. How the role of the government in to change the participation and also for the government offer in a smart city. Yes, there's various from the Indonesia, from Sumatra to Papua. Yeah, but the government is trying to make some project in digital transformation now. Start from the this year, President of Indonesia Jokowi announced the 5 program in digital transformation. One is the connectivity, because there are about 12,000 rural are not yet connected with the internet. In among 75,000 rural area or village, and the second is how to change the stakeholder using the digital technology. The third is digital talents. In the digital talent program, there are many programs with one is digital literacy, how to improve the citizen to use the computer, to use the ICT, and how local government also participate in a movement for the digital transformation. And the fourth is data center, because data center is very important for from the people center to data driven smart city. We need a data center or data management. And we have the president decree in one data, one Indonesia. It's not so easy to regulate, to manage becoming one data, one Indonesia. This is one of the issue in our country. I assist some cities now how to manage the data from the data production to data management using data governance. Because data everywhere now, from the data manually given by the governmental officer, and also IoT, for example, CCTV data, temperature data, and so on and so on. This is very important, how to regulate, how to manage the data in one city. But the president has a decree, announced the president decree regarding one data, one Indonesia. It's not so easy. The 5 digital transformation policy. There are a lot of intercollaboration between sector and sector. For example, sector of health, sector of home affairs, sector of ICT, sector of financial, and so on and so on. There is, sectoral ego. I don't know. I think in Japan, I don't know. There's a sectoral ego actually, or no, I don't know. But in Indonesia, still the problem for the how to integrate, how to manage every sector becoming in one regional. Yes, this is our challenge in our Indonesia. So hopefully we can solve the problem with the digital transformation by President Decree. Thank you very much.
Thank you very much for your great, and thank you very much for showing your issues also and great and suggestions. Okay, the next is Dr. Jirapan. So today you made explanation on digital divide in Thailand. So how to reduce digital divide among the older persons and promote social inclusion. If possible, please explain the topic more in detail.
Thank you for the question. I think that the cause of the digital divide is one is the lack of the device, right? And the second one is the lack of the skills. I think that the device part is one thing that we need to do is to have I think the government has to help in terms of subsidizing the device in order to older people to have access to like smartphone or more tablets where we used to do that. I think a couple of years ago we introduced like less than $100 device for people in Thailand. And it's quite successful, and I think they should do more on that. And for the skills part, I think the true way that we can reduce or improve the inclusiveness is one is to do especially university can help. At Thammasat we have called senior citizen schools where we have, I think, very similar to what Professor Tang did in Singapore, where we invite, senior citizens, allow Thammasat to come together and to learn something, and we will have a lot of, some basic computing class. We have some kind of, how to use social medias, how to take care of privacy online. So we have that kind of school, and it's offline school. And so senior people, they're coming together, so they make friends, and so they are they're learning together. And another thing is, I think is the job of the government to introduce useful service for them. So if they have a useful service, they will use it. I think last year that our government did a really good project on a program called Half. half is the when you buy something, you only pay half. The government will pay another half. But in order to use that, you need to download an app using your smartphone, and it turns out that a lot of people are using it because they benefit from it, right? Because when they buy something, they only pay half of the cost, and the government will refund to send another half. And I think, but this applies to everybody, not only for older adults. So and of course, older adults they like to access this kind of service as well. And finally, I think another thing is that if older adults that have children can teach them. I think it's really good. I mean, family members can introduce some digital skills to senior members of the family. So yeah.
Okay.
So this.
Thank you very much. So this is a very important topic. So we'd like to share this topic in order to create a society no one left behind and for the SDGs. Okay. And finally, here today, Professor JP offered to attend at this forum. So if possible, could you kindly make some short comment for our web forums?
Thank you, Professor Iwasaki, and thank you, Professor Obi and Tang, Professor Yang, Suhara, and Sunfo for the wonderful talks. Just wanted to highlight Professor Iwasaki's scene setting in the beginning about the importance and priority of smart silver innovation and some of the challenges with digital divide and social inclusion. And then also highlight the from each of the talks, the whole of society aspect of smart silver innovation. Professor Tang highlighting community networks and design and a really excellent approach to the health coaches, both from the coaching in the beginning with the health coaches, the identifying of the elderly, and then the metrics. Professor Yang, the development of contactless innovation and contactless services. Professor Sohara very much highlighting the whole of society, the role of resilient cities in silver innovation. And the Professor Sunfo with a very interesting example on the role of, with the digital divide, multi-channel service delivering or being able to access or connect with seniors through multiple means until they are fully resilient and fully have access to computers and phones. So thank you very much for the wonderful event, and thank you, Professor Iwasaki and Professor Obi.
Thank you very much for your great comments. And Professor Obi, it's raising your hand. Oh, I cannot hear you, boss.
Yeah, thank you. At the last, on behalf of the APEC E-Government Research Center, I'd like to thank for Dr. Iwasaki and distinguished speakers and some audiences. I hope this forum between APEC and IAC will continue next year, next year too. That's my message, and really deep appreciation for your contributions. Thank you.
Thank you very much for the great comment. Okay, I'd like to conclude today's sessions. Thank you very much for all of your participation, not only APEC, but also the economies. We could have very fruitful presentations and discussions. So today's forum will be expanded to all generations related to the aging society and also contribute to the digital society. So aging population has profound implications for many facets of human life. So aging population will affect everything, from economies, labor market to health and social care. So therefore, today's session will be more meaningful to suggest the solutions for the convergence between aging and digital societies and after COVID-19. Also, we'd like to continue APEC project on the smart silver innovation in order to create a sustainable and resilient society as well as the SDGs. So I'd like to say thank you for all of other participations also, and see you next time. Thank you very much.
No photo? Not together photo?
Photo, okay.
Yeah, photo together. Who
Please
will photo?
turn on your cameras.
Jirapon, Sang.
Yan-san and Bandasai-san. Also other speakers and panelists and observers.
Yeah, please video on.
Okay.
Yes.
Okay, we
Please
can
send by email.
3. Okay. 1, 2, 3. Okay, and
Okay.
one more time. One more time.
Thank
1,
you.
2, 3. Okay, thank you very much for your cooperation.
Thank you very much.
Bye.
See
See you next
you.
time.
Bye. Bye.
Bye bye.
Thank you.
Thank you.
Bye.